Hi, my name is William. I'm a blood cancer patient. This channel is all about my experience as one of the first people to be treated with a combination of two different drugs, Ibrutinib and Venetoclax, as a first-line treatment for CLL stroke SLL. Can I say right at the beginning, I'm not a doctor. I'm not a medical professional. This channel is all about my experience as a patient. This channel is dedicated to my spouse, who's been hugely helpful during my journey with CLL, to my fellow CLL patients, to the families of those patients, to the doctors, the nurses, the hospital assistants, the clinical staff, the admin assistants at the various different hospitals who treat people with CLL, to the very brave patients with CLL who are involved in trials for new drugs for CLL, and to the medical professionals and students who are thinking about devoting their careers to finding a cure for CLL. CLL is a journey, not a destination. I express my sincere thanks and huge gratitude to John Gribben and to the team at the London Clinic, who were absolutely fantastic in helping me on this journey. Hi, welcome to my video about the combination of Ibrutinib and Venetoclax over a 15-month fixed term period as first-line therapy for CLL stroke SLL. As I've explained in my other videos, there are two different drugs involved here, Ibrutinib and Venetoclax. Now, I've done separate videos on both Ibrutinib and Venetoclax and my experience of those drugs. But today what I want to focus on is about the combination itself. So just to give you some background, I was diagnosed literally days after the two drugs were authorized by the authorities here in the UK. So I was one of the first people in the UK, and I understand in Europe, to have had the opportunity and the privilege to actually be on the combination of the two drugs. I plus V is what the medical professionals call it, right? Ibrutinib and Venetoclax. So there's a lot of pills involved here. And one of the things that worked for me, once I'd had an opportunity to think about it, was to take all of the pills at the same time of the day. So what I used to do was, over breakfast, I would have the opportunity to eat a full breakfast with plenty of Greek yogurt and croissants and lots of different food, and some peppermint tea, which is good for the stomach. And then once I'd finished breakfast, I would go straight into the pills. And I always took the pills at the same time of the day and in the same order. It worked for me because it made sure, from my perspective, that I didn't forget anything. So the pills I took in the order that I took were as follows. First of all, febuxostat. Now, you'll know from the Venetoclax video that febuxostat is a restrictor for uric acid, which is a side effect of Venetoclax. So one pill of febuxostat. Then I took the Venetoclax, 4 by 100 milliliter pills. I then took the Ibrutinib pill, which is 1 by 420 mils. I then took the omeprazole, and you'll know from the second of the Venetoclax videos that when I had some stomach trouble caused by the Venetoclax, that I was prescribed omeprazole. It's very good for stomach lining, excellent drug, I'd strongly recommend it. I would then move on to the cetirizine hydrochloride, which is a small little 10 milligram pill, which I take for hay fever and for other allergies. And lastly, the vitamin D pill, which I took on a daily basis. So you take the pills at breakfast, it's out of the way, you get on with the rest of your day. Now, if I had an early flight, what I would tend to do would be to do the flight and then to take the pills with some food after I had landed at my destination. If that wasn't possible, if it was a longer flight, I would take the pills on the plane with food on the plane. The point is to take the pills insofar as you possibly can at the same time of the day, and to make sure that you are taking them all in the same order. That's what worked for me. Now, talking about flying and traveling, specifically through airports, you've got some chemotherapy here. So what I tended to do was to put the Ibrutinib and the Venetoclax, and sometimes with the Venetoclax, there's quite a lot of packaging involved, particularly if you're going for, a medium or a longer term trip. I'd put all of that in a lunchbox. and I would make sure that if the um, people at the airport wanted to search my hand luggage, that they knew that there was chemotherapy in that particular box, and to ask them to have a new rubber gloves to actually go through the searching process. And they were all very, very good on that basis. I also asked my doctor to provide me with a letter that basically said, to whom it may concern, my patient is William and he has CLL stroke SLL. He is taking a combination of Ibrutinib and Venetoclax for his CLL and therefore needs to have these drugs on his person. Yours sincerely. And that was there just in case there was a problem. Again, if you're bringing quite a bit of Venetoclax through customs and somebody wanted to stop you, you have the letter that you can actually provide, which gives you coverage on that. I never needed to do it, but it was good mentally to have that particular perspective. So, as you know from the Venetoclax video, look, if you're drinking between 3 and 4 liters of water a day while you're on the Venetoclax, and I was, and you are traveling, then the old adage, never pass a toilet, comes to mind. And I certainly follow that, and I would recommend it. It's an extremely good idea and extremely beneficial. And important, as I said on the last video, to keep sipping the water during the course of the day, particularly for the Venetoclax around all of that perspective. So you can travel with these drugs, you can work with these drugs, you can live a normal life in terms of that context. Now, one thing I did want to say is I did have one adverse event, what's called in the medical terms of an adverse event, and I had that right at the beginning when I was just taking the Ibrutinib. And I took the Ibrutinib, and unfortunately, I developed an adverse event that resulted in 14 days in hospital and an operation to debride one of my lungs and also to glue, believe it or not, that lung to the top of my diaphragm. It's called a pleurodesis. It was quite a painful procedure, if minor, but once it was done, and then I very much got on with my life around that piece. And this brings me to the final point I want to make around this combination of the drugs. These are very powerful drugs. You must respect them, but you can live a perfectly normal life with the drugs. And I think in the context of this, and you do find it with a lot of these types of drugs, that what they do is they knock the immune system down to then bring it back naturally. And because of that, you can be a little bit immunocompromised or immunosuppressed during the course of the treatment. And people react to that in different ways. And I think it's very much a paradigm where on one side you stay inside your house and your world gradually diminishes in size because you need to be away from crowds, you need to have very careful perspectives in terms of people coming to see you. And on the other side, there's let's go night clubbing and go and run around and do as much as possible. Well, I chose to be sort of on the right side of that line. I'm not a night clubber, I haven't been for many years, but I certainly did a lot of traveling, both by land, air, and sea during the course of my 15 months of treatment in multiple different locations and multiple different countries, and whilst also doing a full-time job and getting as much done as possible. Now, yes, I was careful with crowds insofar as that was possible. If someone around me was coughing or sneezing, I would try and move away. That's not always possible, but it's possible more often than you think if you do it politely and you're appropriate in terms of all of that sort of context. So to summarize, 2 fantastic drugs. They do work well in combination. They're extremely powerful. You have to respect them, but you can live a normal life. And that's what this channel is very much all around. So thank you so much for taking the time to look at this video. If you like this video, please hit the like button. It does help with the algorithms. If you like the style of this video, please hit subscribe so you can get future content from this channel. Thanks again. And remember, CLL, it's a journey, not a destination. I'd also like to express my sincere thanks and huge gratitude to John Gribben and to the team at the London Clinic, who were absolutely fantastic in helping me on this journey.